Welcome to Penrose Learning, where we make understanding easy.
You begin now. Select the right cuff and position the patient. Place the cuff 2 to 3 cm above the elbow with the arterial arrow over the brachial artery so readings reflect central pressure. Once done, support the patient's arm at heart level. This prevents hydrostatic error. Make sure clothing is loose and the patient relaxed. Talking or tensing changes values. Prepare the bulb and gauge, check the valve closes, and palpate the radial pulse to estimate cuff inflation pressure before auscultation. You now perform the measurement. First, palpate the radial pulse and inflate the cuff until the pulse disappears, then add 20 to 30 mmHg. This prevents missing a high systolic. Once stabilized, place the stethoscope over the brachial artery and deflate slowly at about 2 to 3 mmHg per second so you can detect choric cough sounds clearly. Record the systolic at the first clear sound and the diastolic at muffling or disappearance. Write down arm used and position for consistency. You finish by fully releasing the cuff and removing it. Allow 1 to 2 minutes before repeating if a second measurement is required. If your sounds are faint or inconsistent, check cuff size and placement, ensure the stethoscope bell rests lightly over the artery, and maintain a steady deflation rate. Make sure the patient is quiet and relaxed. Troubleshooting tip: if readings remain unreliable, swap to the other arm and repeat. Persistent problems suggest equipment leak or need for recalibration.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.